because anyway, see, we started with opium. Any quick questions in opium? Opium in our question below. Okay. So what did we discuss in last class? And the physical appearance. Okay. See, okay. See, these were the objectives. If you remember, 4 things we spoke. Sorry, 3 things we spoke. Sphere of action, pathogenesis, and of course we spoke of the ailments, and how do they look physically is what we discussed. Okay. So we'll have some small questions so that we get a continuity and then we'll continue. See, I just want you students to answer the action of opium on brain. Congestion and coma. Very good. Congestion and coma. Good. Second thing is action of opium on heart. Okay. Decrease. See, one of the friend is telling arteriosclerosis. You agree with it? But no. I did mention arteriosclerosis in the last class. We had compared. Yes. We had compared with Barretta cardiac. So don't get confused. Barretta. Okay. Here what is happening is the heart rate decreases. Okay. Vagus paralysis. Good. Very good. Good. And action of opium on kidneys. Decrease secretion. So urine is becoming solidified. Kidney stones. And I also mentioned 2 better remedies. Good. Last question. Recall 4 ailments of opium. Okay. Let me know once you have done this one. Joy? Yes. And this is a lot of anger, fight, shame. Yes, lead poisoning, insult, fumes. What are those fumes? Okay. And how do they look physically? The physical constitution? They look very emaciated, lean, thin, old looking. Okay, chalo. Very good, old looking. Okay. Yeah, anyway, I'm happy that you could remember the majority of the things that was told in opium. So I told you opium is a very deep acting remedy, and we are in no hurry of complaining opium, in a very short span. I told you we will be dedicating 3 solid hours for opium. Okay? And today we will be focusing on 2 very simple objectives which I had already given in the last class. One was mind, and the second very important thing was characteristic symptoms. Okay. So in today's class, I will try to describe the mental symptoms of opium. That will be our first objective. The second thing is we are looking at the characteristic symptoms. This being a polygraph, you have a lot of characteristic symptoms. So we will just try to list what are those characteristic symptoms, and keeping the second case in mind, whatever remedies can be compared, I will try to take up those remedies. Okay. Now again, if you look at mind, I will just share a small case and then we will go ahead. See your books, Materia Medica books, the repertory, when you look at the mind chapter, you have some 900 plus mental symptoms of opium. Okay. And if you are very happy that I am going to give you all the 900, I am not going to give it. Okay. See, because understanding materia in second year, and must be if you come to PG, when the same opium is taught by your teacher, the way how they teach opium will be very different. Okay. So I have this limitation that you are a second year student, and I will be giving you what is required for a second year student. Okay. And beyond that, it's a CBDC curriculum. You can always go back home and you can read. from any source book. The list of books recommended, you have it in your syllabus. Okay. So I'll just brief you. We had one case. Though I did not prescribe opium for this particular case, I want you to understand the situation. An elderly patient, okay, and you know what was the problem is he had gangrene. He was a diabetic, okay, and left leg had almost gone into a gangrenous state, and he was admitted to a hospital. And there he was fighting with the nurse, there he was fighting with the doctor, telling, I am absolutely fine. I have no issues. Why are you people keeping me in the hospital? You know, the surgeon was planning to remove his leg below knee amputation. It was so bad. Okay? Now, as a second year student, what comes to your mind? Is it a normal reaction or is it an abnormal reaction? I'll keep it simple. Is it a normal or an abnormal reaction? What made you feel it's an abnormal reaction? Because it is gangrenous, there is discharge coming, there is smell coming, and you know, the doctor wants to, the surgeon wants to cut below knee. But this gentleman says, I have absolutely no issues. I am absolutely fine, I have got absolutely no issues. You please discharge me right now. Fine? Okay. So now this was considered, and he was prescribed a different remedy. I will not name the remedy, but then luckily we could save his leg going under amputation. I'll share you the images after some time. Okay. But what I want you to understand is a gangrenous leg, but he was telling he is absolutely fine. This was his mental state. Now what is this you have here in this remedy? Does this remind you of another remedy? Very good. Good. I am happy. Arnica. What was the situation in Arnica? Though he was down with fever, though he was down with illness, what would the Arnica patient tell? I am fine. And you tell doctor, you please go. I am okay. But if you check the temperature might be 104, 105. But he says, no, I am fine. I am absolutely fine. Okay. So this same thing you also have it in opium. Opium has that mindset that there is nothing wrong with them. They are absolutely fine. Luckily, with the right homeopathic remedy, we could save that old man's leg. Okay. So basically, what you see here is the characteristic mentals. Keeping the second year in mind, I am just giving you few, must be some 20, 30. Okay. Basically, what you see is opium is very alert. If you go back to the sphere of action, I told you exact opposite. What did I tell you? There is depression of the nerves. So opium has two actions. What is it? A primary action and a secondary action. So what you see initially is they are very, very alert. Extreme sensitiveness of all senses. Extreme sensitiveness of all senses. Very alert, very quick to act. Very quick to act. Okay. My teacher, my sir was sharing a case when we used to attend his classes, his lectures. 104 fever. Child is having 104 fever, and child is very drowsy. Okay. And when the dad was taking her outside the chamber, the daughter told, Papa, my chappals are there. Papa, my chappal is there. Meaning, so though she was down, drowsy with fever, she was very alert. And that's when myself prescribed her opium. He made her sit for 15-20 minutes in this chamber, meaning in this clinic, and then the temperature was again checked. Temperature drastically reduced. You are getting my point? So great homeopaths, when people come to them with acute problems with temperature, high temperature, they were so confident about the system that they would make them sit in the clinic, check the temperature, show them on, made sure the temperature reduces, and then they would send back the patient. That was the kind of confidence these stalwarts had. In the initial days of our practice, we would just try to send them away because we had our own fear. What if fever increases? Okay, but this is what my sir used to tell. Though she is so drowsy with fever, she is almost in a stupor state, sleepy state, but she was again very alert in remembering the fact that she had left her chappal there and her dad is taking her away of the chamber. She was remembering that. So that is what you have in opium. Now I am sharing this case because in future sometime you get this situation, you should not miss opium. So opium has both. So alertness, and as you just see here, all the senses are very, very alert. This is a very important image. I'll be telling a little more about this after some time. So mind is very active and mind is very alert. Mind is active, mind is very alert. All the senses are very, very active, and opium is a guy just looking at the Google image taken. How are the opium people? Just looking at the image. Very jovial, very good. Right word. Cheerful. Jovial, cheerful, extroverted. Getting my point? They are extroverted people. What do you understand by extroverted? They can easily make friends. They can open up easily. They can mingle easily. Many times you get that vibes in your clinic. They come and they say, as if you have met them before. हम लोग कभी मिला ही क्या? Is a kind of feeling they give you. It is your first visit, it is your first meeting, but then you connect so well and they make it very comfortable. Okay? So opium is very cheerful, opium is highly extroverted, opium is very loud. What do you understand by this loud? Loud. Assuming if I was opium, I wouldn't have required all the sound system. Fine? Okay? They have an inbuilt sound system. The voice box is very, very strong. Okay? They are not low tone people, they are high tone people, very loud. In the clinic also when they come, they are talking, they are very loud. The assistant in your third chamber, second chamber, he is making a note of the case that you are taking. That loud they are, very loud. Right? So, what is opium again from your forensic? This being CBDC, integration. Opium is a drug remedy. Okay? Opium is something that will, it's a narcotic, no? It's a bad thing. Opium is something that will take them to high. It's a stimulant. Right? It is a stimulant. So, an opium constitution is a person who is always high. He wouldn't have taken any narcotics. But that's all there. You are getting the picture? Don't name people. Your friends have already started naming. I am happy you are naming. At least you are able to relate. That's very important. That is the practical material medica. But just make sure the other person whom you are naming is not getting offended. Okay? Done? Hope there was opium and they are taking it in a very right spirit. Okay? So opium is extroverted, very cheerful, very loud. Very loud. And if you just see this image, they are very bold. They are very daring. They are very brave. They are very courageous. Bold, courageous, brave, daring. Okay? Fine? You just give them a task. Yeah, no, I will do it. Fine? Okay? So, and at the same time, what you also see is, opiums are known to be very contented. If you just look at this image, again, they are very happy, very cheerful, very contented. What do you understand by the word contented? Self-satisfied, happy. Sir, I have this much, I'm okay. I don't need more. Exactly opposite to ambitious. Exactly opposite to Naxomika. Naxomika, Baratamap, Lacasis, China, sulfur, phosphorus, platina, very good, platina, oron. ये दिल मांगे more. They need more. But opium is very happy. Sir, I'm a clerk. I'm happy with my earning. मेरे को क्या CEO नहीं बनेगा. Right? But Naxwamika will not be like that. I was a clerk once upon a time. Today I am a CEO. You get my point? But they work very hard. Naxwamika. Okay, they work very hard. Right? So opium is very contented, very happy. Now this is what makes them have this feeling, says nothing is wrong with them. You getting my point? क्या था gangrene था? What was the patient expression? No, I'm fine. There's nothing wrong. And I also told you about something under sphere of action. Painlessness of painful part. Okay? Fine. There's a huge ulcer, but there's no pain. That, so says nothing is wrong with him. Contented, wants nothing. There are no demands. There are no demands in opium. Okay? So moving further. Okay, good. One thing is smoking, but if you just type something in Google image, this is what comes up. People with, see, this denotes they are great liars. Liars. They are great liars. Right? Okay. So, Dr. E.B. Nash, a very known name in homeopathic field, he says blunted morals. What is it? These are people who have no right morals. See, morals can be good, morals can be bad. But these are people who have bad morals. Why bad morals? Because they are great liars. And Dr. E.B. Nash, way back in his Materia Medica, he says, worst liars in the world. What is Dr. E.B. Nash naming opium? Worst liars in the world. Okay? They are the worst liars in the world. Okay? So moving ahead, you also have the symptom in another remedies. What is it? Though he is at home, he wants to go home. Brain. Though he is at home, he wants to go home. The same situation you also have in opium. In fever, in a delirious condition, is talking about going home. Mother, wife, brother, sister, they might be telling, boss, you are in your house only. No, I want to go home. Right? So this is the confusion. This is the delirious state you have in opium. And very much marked in bryonia. The other aspect is dullness of mind giving way to complete imbecility. Now till now what you saw was an active stage of opium. They are very alert, they are very quick. Slowly what you see is, you see this another state where they are completely stupid, where they are completely dull, where they are completely foolish. Okay? They will not understand. Dull, stupid, no willpower, complete loss of consciousness. Okay? So this is the second stage or the second reaction that you see in opium. Opium. So patient may either come in that stage or he might come to you in this particular stage. Okay? And indifference. Indifference, not caring. Indifference, not caring. Indifference to pain and pleasure. Can somebody tell me what is this indifference to pain means? They are not feeling pain, very good. Indifference to pleasure means they are happy with what they want. They are happy with what they have. But they don't care for pleasure. I need this, I need bada car चाहिए मेरे को, आज मेरे पास 800 Maruti बस. What will car do, sir? Car will take you to a destination. My Maruti 800 is taking me to the destination. Why then should I upgrade to something bigger? I am happy with this. So contented. Okay? Fine. If it was Naxwamika, sir, I started my journey with Maruti 800 25 years back. You get my point? 25 years back I started my journey. That was my first car. आज मेरे पास No problem. So whichever is the latest, I have that with me. I don't want any idea. We are not promoting any car here. But what I want you to understand is, this is how the mindset will be. Okay. So the mentals, to keep it simple, what did you understand the mind part? They are highly contented. They are very active, very alert, very loud, and they are great planners. They are great planners. See, because of that voice, because of that planning, because of that extroverted thing, OPIUMs can be great orators. You are getting my point? OPIUM can be great speakers. I mean, assuming your teacher is an OPIUM, you will all be eagerly waiting to listen, because that's the kind of energy OPIUM can bring in. Right? Okay? So, I mean, great orators, great planners. They all plan very big things, OPIUM. Right? OPIUM. Okay. So, quickly the characteristic symptoms. Okay. So, we already discussed that there is what is it, stupor state, drowsiness. Okay. Now, what is very important for you, when you read Allen's keynote, there's a beautiful point. Now, what is this point? Please read this statement very carefully. Want of susceptibility to remedies. Meaning, lack of vital reaction. The well-chosen remedy makes no impression. Okay? So, body is not in a state of receiving, responding. Okay? So, the best remedy you choose, for example, Naxamika, arsenic, whatever it is, that is the best remedy to a person. But that well-indicated remedy is not acting, because body is not receiving it. Okay? So, want of susceptibility to remedies, lack of vital reaction, the well-chosen remedy makes no impression. Please remember this, a beautiful statement. You will be told about many remedies in future having this particular situation. Have you come across any other remedy? When well-chosen remedy fails, give this. Okay, one remedy, very good. One remedy, good, keep it up. One remedy is sulfur. You have, beautiful, good. Carbohydrates. Nahin. Next, nahin. Calendula, nahin. Fine. Sulfur, sorinum, larocirrhosis is a rare remedy. Make a note. And of course, one lady said carbohydrates. Young lady, sorry. So, when I said lady, she was feeling very offended. Okay, sorry, young lady. So, sulfur, sorinum, larocirrhosis and carbohydrates. See, calendula, somebody was talking about calendula. Where do we think of calendula? Yeah, it is mainly thought of in cancerous affections. As an intercurrent in cancerous affections. Okay? And I was also reading CS stomach, when the patient is vomiting only blood. That is calendula. When the patient is vomiting only blood. How is it in acetic acid? In acetic acid you will have coughing, not vomiting. Fine? Okay? And in calendula there are vomiting only blood. Calendula. Surprisingly calendula. Okay? So, lack of reaction is one very important thing, and a small extension of this is looking at the image. What is the second characteristic symptom? Yeah, painlessness. They don't feel the pain. Actually, what has to be painful, the person in OPIUM, because the nerves are not been very active, they will not feel the pain. So, painlessness, okay, all complaints with great stupor, great drowsiness, painlessness, complaints nothing, wants nothing. We have discussed this. So, painlessness and stupor. Our old Materia Medica uses the word torpor, T-O-R-P-O-R. Torpor meaning against slowness. Everything is slowed down. Okay, sluggishness, everything is slowed down in OPIUM. Okay. The third very important thing, is the breathing pattern. The breathing pattern in OPIUM. So anyway, we're studying in detail in your medicine class, but stertorous breathing is what I want to highlight here. Stertorous. Stertorous breathing. Heavy, okay. I'll come to this a little later. It's a type of noisy breathing. Noise created in the nose or the back of the throat. It is typically low pitched and most closely sounds like a nasal congestion you might experience with a cold or like a sound made with snoring. So more in detail you can open your medicine book and you can have a look as an assignment. But this is a very important breathing, especially when you are posted to ICU, you will be seeing patients having this pattern of breathing. In coma, OPIUM is a beautiful remedy. Okay, coma, OPIUM is a beautiful remedy. And breathing stops on going to sleep. OPIUM will have difficulty in breathing, and once they lie down, what is the thought they get? They feel like, I'm not able to breathe anymore. So breathing stops on going to sleep. Breathing stops on going to sleep. Okay? Now this is very important. What remedies come to your mind when you see this image? Very good. Sulfur, arsenic, epis, hepacin, phosphorus. Now you tell the remedy. 3 to 4 glass, even if it is a long remedy, I am happy. At least you are all there listening. Though it is a long remedy, mine would have gone a little slow down. So arsenic, what is that burning you see in arsenic? Amelioration by?
Body burning.
Burn. Burning like fire. Right? Better by warmth. How is it in sulfur? Burning in spots. Sulfur, burning can be in the palms, in the soles, or anywhere in spots, and burning better by cold application. How is it in phosphorus? Burning mainly in spine, these areas. Okay, and better by cold again. Burning in the abdomen, burning in the stomach, epigastrium, better by cold. Is phosphorus. Okay, but the burning that I have showed here has something different. Now, what is it that you all have to realize is, any remedy that comes to your mind when we talk of, when I show you this image? Very good, arnica. So, what happens in arnica? What is? I'm happy your friend said arnica.
Soreness.
They keep searching for a soft place.
But they don't get.
The best, softest thing you give it to arnica person feels it is hard. So they keep searching for soft place. Restless, they keep searching for soft place. Restox is also restless. How is Restox different from arnica? Simple. Why Restox is also moving, arnica is also moving. Restox is moving because movement ameliorates. And why is arnica moving? Arnica is searching for a soft place. Arnica is searching for a soft place. Restox cannot lie down because if he lies down, this complaint increases, aggravates. Okay. In OPIUM, the bed feels hot. What is it? Bed feels hot. HOT hot. So they will be searching for a cooler place.
No.
You getting my point? Yeah, it could be anything. But for them, bed feels hot and they will be searching for a cooler place. So they keep changing. So they keep moving. That is OPIUM. Bed feels hard. HARD, hard, and then they keep searching for a softer place, that is arnica. Clear? Okay. So this is something you already saw. What is it that you saw? There is emaciation, there is marasmus, and there is so much of loss of flesh, loss of muscle that the child looks like a dried up old man. The child looks like a dried up old man, wrinkled skin, and child looks old for his age. So that is the OPIUM characteristic symptom. Now, what remedies come to your mind when I show you this particular image? Next one, very good. China?
China.
Okay, China.
Hello.
Alos, yes, good, alos. Karpovich. Arsenic, very good. Belize. What happens in Belize? Okay, very good, okay, good. Okay, man. Yeah, good. So, okay, everybody sir, at least good, keep it up. So, okay, alumina. Asculus, good. So, you are getting this point. You are getting this point. One image and so many remedies are coming up. First year only, probably if you would have showed this one image, the number of remedies would have been less. Now I am very happy that being a second year student, you are able to relate so many remedies. Now each of these remedies will have something to contribute when I show you this particular image. What will happen in Bryonia? Dryness. And you know the result in Bryonia, because of dryness what happens? Only constipation. What will happen to the stomach? What is happening in the stomach? Bryonia. Sensation of stone. Heaviness in stomach, sensation of stone. Why do they have the sensation of stone in Bryonia? So what? So there is decreased secretion of gastric juice. There is decreased secretion of gastric juice, because of which digestion is getting affected. Food is remaining in the stomach for a longer time, and they have that heaviness. Bryonia. Okay. One of your friends was shouting asculus. Asculus is somewhere here. Fine. So what is the character of hemorrhoids here in asculus?
Peanut.
Very good. Was that peanut? Peanut. Small peanut shape. And what was also special in asculus about hemorrhoids? Okay, more than sticks. Good. Sensation of sticks. Back pain. One more point. Very good. Who was that? Blind. More pain, less bleeding. Asculus. Very good. I am happy you use the word blind. Good. There will be no bleeding, but there will be more pain. More pain, asculus. Good. And any other remedies you can think of? You are also talking about belly. Good.
Abdominal complaint after cold water.
Abdominal complaints after
Cold pains.
after deep surgical injuries. Sorry, after deep surgical operations. Or gastric complaints which comes after drinking cold in hot weather. Belly. Okay. Then arsenic andre, lipo andre, podophyllum andre, very good. See, podo again affects the lower bowels, duodenum and below, and it will cause diarrhea. It will cause diarrhea. Carbohydrates, lycopodium, cinchona, they will cause more of flatulence. They cause more of flatulence. Okay. Now, very important is what will opium do? We already saw in the sphere of action. It causes dryness. More than dryness, what you also see in opium is it causes paralysis. Paralysis. So what you see is it causes a bad constipation. See, constipation in Bryonia is because of dryness. Constipation in opium is mainly because of inactivity, paralysis or paralysis of the muscles. There will be no movement. That's what is causing constipation in opium. Okay. So constipation, and again you can also see paralysis of the sphincter. Okay. The bladder muscles. They go into paralysis. What happens when the sphincter is paralyzed? Two things can happen. One is there can be retention or there can be incontinence. Okay. See here, retention of urine in nursing children. Which is the other remedy? Retention of urine in nursing children or retention of urine in newborn. Retention of urine in newborn. Yeah. Huh? So retention of urine in newborn. One of your friend has given you the right answer. Aconate. Aconate. First year remedy. Don't neglect first year remedy. Aconate. Fine. Chamomilla is a different situation. In aconate, retention of urine in newborn. Generally what our allopathic friends do is, for example, newborn, the baby is not passing urine, many times they have to catheterize. Okay. So aconate can do wonders in such cases. Done? So retention of urine in nursing children after a fit of fright in nursing mother. Please read this statement thrice till you understand. The mother is feeding the baby, fine? And baby has got absolutely no issues. Mother has gone into fright. किसी चीज से डर गई माँ. She in that fear fright state she is feeding the baby. And what is happening to the baby? There is retention of urine in the baby. Dr. Kent beautifully gives you in one remedy, if I am right, argentum metricum. Is it done for you? Please read argentum metricum in Kent's Materia Medica. He says, mother eats candies. She feeds the baby and the child will have diarrhea. And then Dr. Kent gives argentum metricum to the mother and child feels better. You get my point? So mother's emotions through breast milk it affects. So Dr. Kent gives argentum to the mother and via feeding, argentum also goes to the newborn or the baby who is suffering and his or her diarrhea gets cleared. You also saw this in chamomilla. What happens? Mother is angry, she feeds the child and child is throwing out convulsions. Seizures in children. So these are a few important things. Retention after parturition due to paralysis of the bladder. Okay. Paralysis can also be seen in tongue. What happens when there is paralysis of the tongue? Yeah, speech gets affected. What we call it as articulation. Articulation becomes difficult. So constipation, retention of urine and speech getting affected because of paralysis. Yeah, this is constipation. We'll discuss more in the next class. So one more serious situation you can expect in OPIUM is intestinal obstruction. Please go back home, read in your surgery books intestinal obstruction. I am not going into the details. See, when there is intestinal obstruction, then there will be reverse peristalsis. Any big idea what happens when there is reverse peristalsis? Vomiting of what? Vomiting of fecal matter. Vomiting of fecal matter. Okay. So intestinal obstruction, vomiting of fecal matter. OPIUM. Remember, these are all emergencies. Fine. It's all given, contributed by very reliable authors. Okay. Intestinal obstruction, reverse peristalsis, fecal vomiting. Yeah, we saw this. There is sleep overpowering. And if you remember the first case of OPIUM that I shared, one of our colleagues' child who had high fever and she had excess sleep and the ailment was fright. Okay. So sleep overpowering can be one thing or exactly another state can happen in OPIUM. What is it? Sleeplessness. ಎರಡು ಇರಬಹುದು. Sleepy or sleeplessness. Okay. Now what causes sleeplessness in OPIUM? Can you remember the first statement that I gave you? The senses are oversensitive. The senses are oversensitive. What is that senses? And I also showed you one one diagram taken from Google. Hearing was very, very acute. I just did this, and it can be something for OPIUM patient. They are very, very sensitive to noise. Hearing is very acute. So what happens in OPIUM? See this, how beautifully given in Kent's Material Medica. Dr. Kent very strongly says the tickling sound of the clock. Somewhere, some tree, some bird is making some noise. Or house flies walking on the, or some fly is walking on the wall. How many of us can understand? Many times, many of the people, thief would have come, gone, robbed the house. They are deep asleep. Lucky people. So there it is exactly opposite. Sleep deep. Here sleep is very superficial. They hear clocks striking, the crow crowing, or doors closing and shutting. Almost hears the flies walking on the wall. So sensitive the hearing is. And this is what disturbs sleep in OPIUM. See, sleep can be disturbed for various reasons. Okay, each patient can have his own story why his sleep is getting disturbed. In OPIUM, the sleep is getting disturbed because of all these small things. Small things can bother, small things can disturb the sleep. So this is with OPIUM. So OPIUM, before I close, we'll have a quick recall. What did we discuss today? We spoke of mind, and under mind we had two states, an active state and a dull state. And in active state, what did we see? That they are very alert, they are very active, mind is quick, they are cheerful, all the senses are acute and very extroverted, loud, and they are great orators, great planners. Liars. See, no morals. See, morals can be good and morals can be bad. That's what I was trying to tell you. Liars, okay, is a bad moral. Telling lies is a bad moral. Fine. Many other examples you can think of for bad morals. Cheating, deceitful. Fine. Okay. We'll talk more as you grow more into this particular field. We'll be talking more of bad and good morals. And in the dull state, what did we see? They don't understand anything. They can be idiotic. They can be foolish. Mind becomes numb, and mind becomes imbecile. Okay. Then we spoke of characteristic symptoms. What were the characteristic symptoms? Want of susceptibility, want of reaction. You saw that painlessness of painful parts. Second, third, bed feels hot, so they keep searching for a cooler place. And then we also saw the paralysis. Okay, and then we saw that though he is at home, he wants to go home. Okay, then what else?
Noisy voice. Noisy breathing.
Noisy breathing, stertorous breathing. We also saw intestinal obstruction, and then the vomiting, fecal matter. Then, and how the child looks. We also saw the sleep. It can be sleep overpowering, or sleep is very, very light, very superficial. Hardly any sleep. Both the things are possible in OPIUM. Okay? Any quick clarification? Anything you want to ask? So if things are clear, in the next class, I will be taking one more class this Friday. So there we will be trying to complete the OPIUM. Important particular symptoms I will be focusing. Okay? Done? So please read this, today's topic and previous topic. Our future class of OPIUM will become very smooth and very easy. Okay? So thank you.